Hello guys, welcome to my YouTube channel, Dr. Shahnawaz. And in this lecture, I will talk about the GERD, that is the gastric acid reflux disease. Actually, in this disease, we have the acid reflux, and we present with the symptoms of heartburn or chest pain like this. So we continue to the video and explain further. In the overview, we will talk about that what is the GERD. Actually, GERD is the reflux of the gastric acid from the stomach into the esophagus. And next, I will talk about the causes of the GERD, like what are the main causes of the GERD and how the GERD is caused. And then the symptoms due to GERD is like making the clinical presentations, and at the end, like how to treat the GERD. So we see that what is the GERD in physiopathology. We see that the excessive lower esophageal sphincter relaxations may cause the GERD, because of which the sphincter is not closed well, and the gastric content will be refluxed into the esophagus. And also other lower esophageal pressure abnormalities may cause the GERD as well. And as the relaxation of the LES may cause the resulting into reflux of acid, bile, pepsin, and pancreatic enzymes as well, because of which the esophageal mucosal is injured, and we see that the mucosal injury may be causing the symptoms and other clinical presentations to the patients. And what are the causes of the GERD? The most common cause is the hiatal hernia. Look at this picture. We see that in the diaphragm we have the hiatus, from which the esophagus is passed, and then we see that there is bulging of the hiatus. We see that there is uh, less, or the esophageal sphincter is damaged, or maybe some bulging, because of which the esophageal sphincter is not closed properly. And another cause is the delayed gastric emptying, like gastroparesis. Look, this picture shows that when the stomach is not emptying at a normal way, we see the gastric content may be reflux out of the stomach into the esophagus. And others, like impaired esophageal clearance and impaired mucosal defensive factors, may cause the GERD as well. And continuing to the symptoms, we see that heartburn is the most common symptom, and this occurs usually after eating. And these symptoms may be worse at night or while lying down. And the regurgitation of food or sour liquid may cause these symptoms of the GERD. And the abdominal pain, like mostly upper abdominal pain or chest pain, are the symptoms of the GERD. And there is lump sensation in the throat. The dysphagia may be present because of the gastric content may be causing some problems to the esophagus. It may cause the spasm of the esophagus, and the dysphagia is present. Thank you for your attention. This is the finish of the GERD, and in the next video, I will share the treatment of the GERD.